Bismillahirrahmanirrahim. Today I am going to present a case of appendicular abscess, and in this video we'll mainly focus on presentation, and in the next video we'll include the investigations, the surgery done, and the outcome at the end of the treatment. So let's start with the presentation. Patient was 35-year male and 15 days history of abdominal pain and high-grade fever. So for the last 15 days he was having abdominal pain and high-grade fever. Pain initially was around the umbilicus, and then it shifted to the right iliac fossa, to the right lower abdomen. Now this is very interesting. 8 days back he was unable to extend the right leg. This is right leg. And he consulted a neurologist. We examined him, and the neurologist advised him to have X-ray of the lumbosacral spine and pelvis, and he was very wise enough to advise to have a CT abdomen and pelvis as well. Now this was the presentation when we examined him. Here his hairs, he was very hairy, so his hairs are being shaved. But look at his posture. His hip is flexed and he's unable to extend the leg. We tried to extend his leg because we wanted to examine the abdomen, but he would not allow it because he was in great pain when we tried to extend the leg. Even gently, he was in great pain. So we had difficulty in examination of the abdomen. Now, why was this posture? And this is because of the psoas spasm. If there is irritation of the psoas muscle due to retrosacral appendix, patient complains of pain on flexing the hip. This is known as psoas test. Iliopsoas muscle flexes the hip joint. Now in this case, because of the large amount of psoas abscess, which we'll see in the subsequent investigation, there was continuous spasm of the psoas muscle, and patient did not allow to extend the right leg because of pain. So examination of the patient revealed a very pyraxial patient, running fever. The abdomen was, we were not able to examine it properly, but once he was given anesthesia, he was relaxed and we could extend the lower leg, and we were able to examine the abdomen, and there was a tender mass in the right iliac fossa. He was running fever, he had guarding and a tender mass in the right iliac fossa. The rest of the abdomen was soft. The bowel sounds were present, and I'll come to the investigation in my next video. So this was presentation, unusual presentation. He went to a neurologist because he was unable to extend the leg, but the neurologist was wise enough to have a CT of the abdomen and pelvis as well as the lumbar spine. The X-ray of the lumbar spine were normal, but the CT abdomen revealed an appendicular psoas abscess, which we will examine in the next video. Thank you very much. I hand over here and we'll continue with the next lecture.